My dear friends, at the very outset, I wish to thank the organizers of the Ninth World Congress of Teledermatology, and very particularly and specially Professor Amanda Oakley, for giving me this wonderful opportunity to talk on the status of teledermatology pre, per, and post COVID 19 in India. I have to particularly declare that I have no conflicts of interest. This is the institution where I work, the Chettinad Academy of Research and Education, one of the largest institutions in southern part of India. Just to give a little background, India witnessed a significant surge in number of teleconsultations, and this has been documented in several newspapers and journals, and particularly according to a report by an integrated healthcare company known as Practo. Now, according to Practo, Indians consulted doctors 10 times more during the second wave of COVID, that is, in the months of April and May 2021, compared to the pre-COVID times of January to February 2020. India witnessed a record 30 times spike in online doctor consultations for COVID-related symptoms during this time. Obviously, the consultations seem to be more for the general physician and for the pulmonologist for the COVID-related symptoms. Next came the gynecologists, over 10%, dermatology 8%, and the pediatricians about 5%. The demand for the general practitioners and the pulmonologists was at an all-time high according to the data. While online consultations for these specialties grew by over 30 times in the months of April and May, it stood at 6 times during the last week. To set the background for this topic, all of us are aware of the fact that teledermatology has become a popular platform for providing dermatologic care. And for that, the reasons mainly are the low cost of care, increased efficiency, and high physician and patient satisfaction. Additionally, TD offers a great amount of flexibility in terms of time and methodology. We could do a consultation synchronously as a face-to-face consultation, or we could do a consultation as an asynchronous, or where the photos of the patients are stored and forwarded to the dermatologist. Now, coming to the topic of COVID-19 and TD, the coronavirus 2019, namely COVID-19 pandemic, has fundamentally transformed the landscape of providing dermatological care. In an age of lockdowns and social distancing, TD has emerged as a powerful tool to deliver remote care. Overall, the results of several reviews indicate an increased reliance of TD during the pandemic and overall positive attitude towards this new model of care. There are many promises and positives that have been put forward by this method of consultation. Now, prior to COVID-19, a study nationwide has shown that there is certain definite maldistribution of dermatologists when compared to the metropolis and the urban areas. The comparison of these studies makes it hard for us to ignore the fact that this serious gap has to be filled up, and that too with the social distancing restrictions that have been put by the healthcare authorities. This definitely has to be addressed. Now, what is the scenario in India, my dear friends? India lifted the restrictions of teledermatology. Initially, there were some restrictions, consultations using the TD system. It allowed dermatologists to practice telemedicine during the COVID-19 pandemic. In addition, the extended use of teledermatology promised a great access to care for patients who experience socioeconomic barriers such as inaccessible transportation and difficult work schedules. Due to the fact that patients are able to access TD visits from the comfort of their homes. It is almost a door delivery of healthcare and dermatology care. Aside from improved access to care, teledermatology during the COVID-19 pandemic has had the advantage of being both time and cost effective for the patients as well as for the physicians. Now, definitely, with any form of system of practicing medicine, there are going to be challenges, and every challenge is also going to have a solution. From the patient standpoint, while TD was afforded patients the ability to receive diagnosis without the risk of having to make a personal visit to the clinic, the pandemic has limited access to clinical procedures. Simple procedures like dermatoscopy or a biopsy could not be done. The dermatologists, too, have not been spared of these challenges. They've been stress precipitated mainly by the lack of technical infrastructure to support a fully functional TD service, or sometimes the uncertainty regarding reimbursements for online appointments. So while TD affords the opportunity to inspect and diagnose lesions, but pertinent diagnosis cannot be fully made unless and until the lesions are palpated. So that is one big challenge that we physicians face with teledermatology. So what could we do looking forward? Despite hopes of an end to COVID-19 pandemic, which doesn't seem to be a reality, TD remains an innovative tool in the future care of patients. In order to maintain popularity of TD visits in a post-COVID-19 world, standardized telemedicine training must be implemented for both physicians for boosting up their confidence and also for the patient safety. A plausible solution might include that we could make use of local libraries for telemedicine visits. This would probably find secure areas for TD visits and increase the access to care within rural and low-income areas. Regardless of the hindrances of telemedicine in the future, technological advances are going to appear in TD to provide a positive outlook on teledermatology in a post-COVID-19 world. What are the takeaway points? There are several promises of TD, detractors of TD, barriers of TD, ethical legal challenges. I should just give a few points of each of this before I conclude. The promise of TD, definitely teledermatology prompts an increase in access to care in rural areas, time and cost saving for the patients, time saving for the physicians also, particularly with asynchronous teledermatology, and a potential to establish continuity of care. Detractors might include inability to perform procedures, as I told you earlier, inability to perform full body examinations to make a complete diagnosis, the poor video and image quality that can be transferred to the dermatologist, inexperiences of medical students and residents, which really cannot be given as a detraction because they can always be trained. Potential disparities of TD utilization among the underserved communities. Barriers of several again, just to mention a few: tenuous internet access, technological illiteracy, particularly in the rural areas, lack of legal framework to sustain long-term teledermatology practice, and cultural barriers, of course, which is so common in India. Ethical legal challenges of TD are varied and many. Payment parity between TD consultations and in-person visits, restrictions to practicing across state lines, which is now, of course, been narrowed down, encryption of the TD platform, again, which can be taken care of, malpractice insurance coverage of TD visits. So what is the future, my dear friends? TD is here to stay, there's no doubt about it, and the pandemic has shown that the efficient management of dermatology department requires this tool to resolve a large number of dermatology consultations. In the initial screening, TD is unbeatable for speed and efficacy, and the pandemic has also shown us that it is possible to carry out part of the consultations online, including highly complex cases, with considerable savings in terms of time and expense, and with high satisfaction to the physicians as well as to the patients. So I would like to conclude to say that teledermatology could be a silver lining in the dark cloud of COVID-19. Thank you very much, my dear friends, for your attention.